In wake of present wave of pandemic, mental and emotional well-being is emerging as a prime concern. In this scenario, APJ Satya and Soran Group would like to welcome you all in the first Zoom webinar of this year, organized on an update on Omicron. The purpose of this webinar is to help us cope emotionally with the present situation, which is causing a sense of fear, worry, and uncertainty among us and all our staff members. Friends, without wasting much of our time, I would like to welcome our speaker for the day, Dr. Parveen Bhatia, along with our panelists for this evening, Mr. Vikram Narang, who is associated with us as a GM Sales and Marketing for Walter Bushnell, Dr. Manju Purohit, Head Medical Department for Walter Bushnell, Ms. Anjana Nath, Chief People Officer, Apeejay Education Society, and myself, Sachin, working here as a DGM HR. So I would like to hand over this session to Dr. Manju Purohit now. Thank you.
Good evening, everyone. On behalf of the management and the members of the APJ group, we extend a very warm welcome to Dr. Parveen Bhatia. Dr. Parveen Bhatia is a leading laparoscopic surgeon in India, specializing in minimal access surgeries, bariatric surgeries, and robotic surgeries. For more than 2 decades, he has been a thought leader and a driving force behind the advancement of minimal access surgery in the Indian subcontinent. He is the author of 3 books: Arthroscopic Hernia Repair, Step-by-Step Approach, Art of Endosuturing, and Comprehensive Arthroscopic Surgery. He is also a member of the editorial board of the Journal of Minimal Access Surgery, JAMS, a very prominent journal. His surgical expertise and flair for teaching has accorded him invitations over 500 national and international conferences and workshops on arthroscopy, bariatric, and robotic surgery. Dr. Parveen Bhatia is a man with extensive knowledge and versatile talents, be it academics, be it sports, recreation, subjects of public health importance, and continuing medical education. He has done innumerable programs for students of schools and colleges, and even parents. To add to his versatility, he is a charismatic dancer and a fitness enthusiast. In the current COVID situation, the medical professionals are facing huge challenges for themselves as well as the patients. Looking to the outbreak of the 3rd wave and the prevalent myths and the half-baked information available, we once again have with us Dr. Parveen Bhatia, who has kindly consented to give us an enlightening talk on a very relevant subject, which is the need of the hour, an update on Omicron. Now I would like to hand over this mic to Ms. Anjana Nath, who is going to take the session on Dr. Parveen Bhatia. Thank you.
Thank you, Dr. Manju ma'am. Welcome once again, Dr. Sir. So I will straight away go to my first question. By the time we thought that we have enough of kada and we have enough of haldi milk and we were getting somewhere onto the normal life, and then we are told that there is now something called as Omicron. First, we only knew something called as Corona. Now suddenly there was Delta, Omicron, and even, while we are struggling with Omicron, there are, I don't know how many variants it's coming on. We hear Deltacron, we hear some IHU. So my first question to you, sir, is certainly not about kada, but what are these variants and what is the difference between the 2 variants? I mean, the last wave we saw Delta, and that was quite harmful and fatal. And this time we are seeing Omicron with mild and severe symptoms both. So I would like to pose my first question to you, sir. What is the difference and what do we need to do for it?
Thank you. Thank you very much. First, I must thank Walter and Bushnell, Mrs. Barlia, Dr. Manju Purohit, Mr. Vikram Narang, Mr. Sachin, and Anjana for having me involved in these webinars for Walter Bushnell every now and then. I honestly speaking, I also look forward to when I am going to meet the people who are having energies within themselves and who are always ready to interact, who are always ready to learn, unlearn and relearn. So that this is my submission, that I feel happier when I interact with you rather than you may be having some advantage in the knowledge. One. Second thing is that I would always say that today, as Anjana was asking me, is it going to be PPT presentation or no? No, nothing. Honestly, I feel that if we interact with each other, then all of us will be learners and will carry on learning. Now, about the corona, as we remember that when the COVID-19 had started, so many questions were there, so many answers were there, so many organizations were involved in naming the virus, whether it is COVID, coronavirus, disease 2019, Wuhan virus, and so on and so forth. And CDC from US or WHO or ICMR or so many organizations had come, and so many institutes of virology were involved in knowing or finding out that what is this virus which is causing havoc. But let's be honest about it, after 2.5 or 3 years, still we are standing at the same place. And I would put it absolutely clear that only thing which is certain about this viral business is uncertainty. Most of the times, most of the myths were there, they will be there, they will be broken also, but still the myths will persist. Now, as you asked about COVID-19, and in the first wave and in the second wave, whole of the world had witnessed that how many people had got the lung infection and how many people ultimately had mild, moderate to severe disease. And after having the first wave and second wave, so many deaths had occurred. But ultimately, still we could not find out that yes, this is the cascade of events. All of us were thinking, as scientists also, many things were coming out, whether the virus invades the lungs and then it causes some angiopathies, and then ultimately it leads on to pneumonitis and so on and so forth. But in this business, in last few months or weeks, I would say that Omicron. Now, let me ask Sachin, what is Omicron? What do you mean by Omicron?
So, Omicron is basically a virus which has been...
No. Before that, what I want to know is that I want to try to simplify it as much as simplified as possible. Before talking
Micron is basically if we say micron is basically a very little particle, means very small, which cannot be seen by a naked eyes.
Wonderful. So all the viruses cannot be seen by naked eyes.
Yeah.
So all the viruses should have been called microns?
Of course.
Omicrons?
Yes.
Vikram, do you want to add on something? What is Omicron? What do you mean by Omicron?
This is one of the mutant forms of this coronavirus. They have called, the scientists have named it as Omicron. But the genesis of the name, I don't know, sir. How they have coined the name.
Anjana, you want to say something about what is Omicron? Even before we go for the virus business.
Sir, I love the name. It sounds like a TV brand.
Like Onida.
Absolutely.
Dr. Manju, you want to add on?
So I want to add that Omicron is a variant of SARS-CoV-2 virus.
No, I am just joking. Let's be honest about it, that Omicron is not a new word.
No, it's not.
It is basically, all of us know, Sachin and Vikram, all of us know A, B, C, D, E, F, G, H, all the alphabets.
Yes.
So these are English alphabets, right?
Yes.
And if you go in with Greek alphabets,
Yes.
Greek alphabets, and if you go reach up to O, O means JKLMNO. O is called as Omicron. So what I mean to say, 15th alphabet in Greek alphabets of 24. In English, all of us know that we have 26 alphabets, but whereas in Greek mythology, Greek alphabets they were 24. So in those terms, that is alpha, beta, gamma, delta, and so on and so forth. So if you reach up to 15th alphabet, and that is called as Omicron. And Omicron, as Sachin had rightly said, Omicron means small o. Whereas the 24th alphabet of Greek mythology was Omega. Omega. Omega means it is a mega. It is a big O. And whereas if it is on the 15th place, then it is a Omicron, it is a small micron. One. Second thing is that that means we have forgotten about the Greek mythology, but still the scientists want that we should remember our past also. One. Second thing is that
sir, sorry to interrupt. This means that still 11 will come.
Exactly.
We are still on 15. We are still on 15, sir.
Absolutely. You can imagine that this is the lesson which all of us should learn now. In 1914 to 1918, all of us remember that there was an influenza pandemic at that time also, and it also had similar kind of lessons God wanted to teach us. That please, in that era, when the social media was also not available, in that era also, all of us knew that it is because of the virus. And anytime and every time any person was sneezing, then people used to say, God bless you. Why? Because they wanted to tell that if you are sneezing, if you are putting the virus to some other person, he will also catch it and he will also suffer. Maybe he will have pneumonia, maybe virus, maybe nasal congestion, and so on and so forth. So at that time also, people had started realizing that this is a viral disease and it is spreading from human to human. It is not spreading from human to animals, animals to humans. So again, in this 1 century, if we have not learned that we have to respect that, we have to follow the basic norms of making sure that we are using the mask, we are washing our hands, we are not transmitting the virus from one human to another human. That is the plea which I always feel, and the God still wants that we should learn it. We have not learned it in 1 century. Maybe in next 1 century, if these kind of variants will be there, then we may learn. So in the Omicron, when the Omicron started, it was found that there was a change in the virus, that there was a mutation, and anytime and every time some mutation goes on, because it is the tendency of the virus to stay on. Virus does not want to be killed. Virus does not want to go into the person who is dead. It wants to replicate. And if that is the progress of nature. So if it wants to replicate, it would not lead on to such a fatal disease for any and every one that ultimately people die, and the natural cycle of virus also dies. So that was the change. That is the reason that the mutations occur. So once the mutations have occurred, now let us talk a bit about Omicron infestation or infection. What is happening is that the waves had started with Delta. In Delta also somebody related Delta to Delhi, that it had started in Delhi. The COVID virus was started in Wuhan, but I think it was absolutely a farce. One should not believe that. Only thing is, it has become a pandemic. Omicron, can you imagine? In US also, Dr. Manju was talking about the boosters, we will come later on. In US also, 96% of the infections which are occurring are because of the Omicron. And would you be surprised that still people, I don't know why, have they come out with this concept that it is a mild kind of disease? No. In US also, In New York also, in many other various hospitals, people are going into the hospital. The admission rate is not as much as it was with COVID-19, but it is still there. But the rider is that if the person is having comorbidities means, for example, I would talk of my subject, obesity. It was noticed in COVID infections that if total number of deaths are counted from US to Italy to all the countries, and in those 76% of the people who had died were obese. 13% had diabetes, 13% had hypertension. So what I mean to say that if the person is having comorbidities in these formats, then the chances of becoming moderate to severe infection, even if it is an Omicron, it is still there. One. Second, by introducing the vaccines, all of us have known that if the Omicron is infecting the people, even if they had 2 doses of vaccine, but it has been turned into a mild variety. If the people did not go for the vaccination, we call this as Omicron, the infection of the uninfected, unvaccinated. Infection of the unvaccinated. So if there are still people who are hesitant to go in for vaccination, I think that they are befooling themselves. One should definitely go in for first dose and then second dose, and now is the time of booster also, so that the infection, once it occurs, it should stay on as mild variety rather than becoming moderate to severe. Anjana, does that answer your question?
Absolutely, sir. Absolutely. So my next
Can
question.
I add one line here, sir?
Sure.
You permit me.
Sure.
Feel that vaccination provides us with enhanced immunity. And I think it is this enhanced immunity which is making this Omicron milder. Am I right, sir?
Absolutely right. Absolutely right. Basic thoughts are that we should learn out of this, that body has to respond to a virus, and if it forms an antibodies by getting the infection or by getting the vaccination, and if the antibodies are there, it will definitely fight with the virus, and in that fight it may be dampened. The effects of Omicron will be dampened. But if in Delhi also, can you imagine, even if we have reached a level of 23,000 cases per day, but still there were 97 deaths in last 4 days. Why? And most of the analysis has been seen, all of us have read that, those people who are dying who were having comorbidity or who were unvaccinated. So my corollary of this discussion would be that please do not shirk away from the vaccination. Go in for vaccination, dose 1, dose 2, and now is the time when you have already had 9 months of second dose. Please go in for booster also, so that ultimately the chances of catching the virus definitely is not going to reduce, but chances of getting the mild variety will definitely go up, and you will overall have only sore throat, only fever or running nose, and in a few days, 3 to 4 days, you will carry on settling, and in another 7 to 10 days, you will come out unscathed. The virus will not lodge itself into the lungs of the person.
Thank you so much, sir. So our first question, Dr. Ogra sir wants to know, how does one distinguish between symptoms resulting from flu or cold and Omicron virus?
Very good. At the moment, I would put it this way, that even if, for example, you are having fever, and fever is with chills, and you are having the sore throat, and you are having the lethargy, the malaise, you should always get tested. As simple as that. You should not go with the second diagnosis of flu, of the viral flu. Our thinking is it is good idea to prove or disprove that we are having coronavirus or COVID virus or Omicron virus or not. So please get yourself tested. And if it is found to be positive, then there is no point in taking all those fancy names of medications, which lot of medications floated last wave and last wave. And we should definitely restrict ourselves to crocin or dolo or ibuprofen, paracetamol, and rest, isolate oneself. And within 3 days, the fever is coming down. The sore throat also settles in 3-4 days. And after maybe 7 to 10 days, you are up and about. So please try not to befool the Omicron. Try that, yes, even if you are having fever, even if you are having all these features, think that it is Omicron until proved otherwise.
Sir, as per, ma'am, one question from my side. Sir, as per new ICMR guidelines, they are saying that 7 days of quarantine is now there as compared to 14 days. But now some of the doctors are saying that 10 days of quarantine should be there minimum, even if you are in direct touch with any of the contact with any of the Omicron patient. So what is your suggestion on this?
Let's be very honest about it. I am not the authority and I am not challenging the authorities. But our thinking is, this is not the scientific ways in which the ICMR or CDC or WHO presenting. Can you imagine? CDC also told all the healthcare workers in US that if you have the Omicron, you get yourself tested, and on day 5, you should join back. And then you get yourself tested again. If it comes out to be positive, then go back for the quarantine. So to be honest, that means these kind of the guidelines which are being issued by non-medical people, they are the source of ridiculousness. Let's be very straight about it. If, for example, if you are having an Omicron, if you are positive, then it is your moral responsibility also that if I am a surgeon, if I start going back to my theater on day 5, and if I start infecting all my staff in the operation theater, and my patients also get infected, whom am I answering? Whom am I fooling? So our thinking is, it is a good idea to first diagnose it properly. Once you have diagnosed it properly, then even if guidelines say that after 7 days one should not go in for the test, I would go in for the test. And definitely once the test reveals, maybe there are people who would say because of the killed virus in the throat that you may still become RT-PCR positive. Yes, but even if it is taking 2 or 3 or 4 days more, it is good idea to be RT-PCR negative and then start mingling with people so that you, as a moral responsible person, you are not responsible, you're giving the infection to somebody else. Our thinking is that it is not scientific. I am speaking not exactly scientific, but it is combined with morality, which we should definitely. Why this infection has occurred? Anjana, why should so much of infection has occurred suddenly is because all of us have taken the guards out. Nobody was there. Even if you go to some party, the first thing one would do is, and if one is having the video recording, any and everyone will take off the mask and then start mingling with each other as if nothing has gone wrong. So what I mean, that means we had forgotten our morality. As simple as that.
Absolutely, sir. And on that note, we would like to again reiterate and agree with Dr. Saab that it should become a way of life. Corona, no corona, Omicron, Delta Cron, whatever it is, double mask, or at least single mask is a must, and hand hygiene. I mean, that is, I think it was a given. I don't know why human, we all forgot about it, but we need to make it part of our life. And again, we keep reiterating so that we all remember that. Sir, next interesting question from Ashish Verma. So what he wants to know is, we all do RT-PCR test. So how do we know that we have Delta or Deltacron or Omicron? That's the first part. And second, he says that from the data which is available normally in our organization, because he's one of the people who is handling the vaccination, etc. for employees, he feels that people who have taken Covaxin is getting infected. So that is the two questions which he has.
No, first question, basically thoughts are that even if you had the infection and if antibodies you had developed, antibodies, but still you can catch it. You can still catch the infection and it can be a milder variety of infection. So our thinking is he should carry on taking the vaccination part. Whether, as I mentioned last time also, and you remembered, I am so happy that why should we be bothered about the job, which is not our job. The job of the scientist was to develop Covishield, to develop Covaxin. When we are going in for vaccination, then we are questioning that why Covaxin and why not Covishield. Even if you have gone in for Covaxin, carry on going in for Covaxin 2 and then the booster, so that the chances of infection becoming mild variety are definitely there. And if you had gone in for Covishield, please go on. There is no point in mixing the vaccinations in the sense that dose 1 Covishield, dose 2 Covishield, dose booster dose should also be Covishield. So that settles the boosting part, that settles the infective part. And regarding the first question, you said that he's interested in asking.
We do a RT-PCR test.
RT-PCR.
So how do we know it is Omicron or Delta or Deltacron?
We cannot know. As simple as that. That if, for example, RT-PCR is done, it is seeing only, it is the PCR test which is being done, and it is testing whether the viral load is there or not. And to simplify this, I would put it this way. You please try to understand the basics, that when we get the throat as well as nasal swabs, the report comes, for example, the virus is of the order of 25, 26. Usually it is taught, and I have interacted with our microbiologist also in Gangaram as well as in Bhatia Global Hospital. If the virus load is such that they have to centrifuge the specimen for 35 times, and still the virus is not there, that means it is negative. 35 times, still it is negative. If it is, for example, 10, after just 10 centrifuge, I'm making it absolutely simple. So if these after centrifugation for maybe 10 rounds, if you are able to find out the viral load, that means the viral load is very much there. It is too high a load. And if your report is 25, that means yes, you are nearing 35. You are having a milder variety, not the severe viral load, but still you are positive. In this situation, when they do the RT-PCR test, they do not test the genomes. The genomic studies are not done. That is only done just to find out whether, in order to differentiate, and this is the responsibility of the collective responsibility of the institutes of virology, national institutes, or the higher centers, which will test the genomes and then ultimately tell. For example, as I mentioned, CDC also had tested a great sample, and then they have found out that 96% of the infection in the US at the moment is Omicron, not COVID-19, not Delta. Why? Because they had taken a large sample size. It is not that if I get myself RT-PCR done, they will take my sample for Omicron testing or not. No, they will not, but they will take the large sample and then declare that yes, this is the type of virus which is floating.
Understood.
One question from my
on
side.
a similar note, sorry, Sachin, a similar question. So let me just complete that.
Sure.
Dr. Alka Munjal wants to understand. So a negative report after 7 days, is it necessary? Because ICMR has given the guideline. So we don't know whether it is Omicron or Corona or Delta. So ICMR says that quarantine for 7 days. So we quarantine for 7 days. Is it necessary for a negative report after 7 days? Or quarantine will be over after 7 days?
as I put it, as simplified, that guidelines are there, and guidelines are just to guide you. It is not exactly telling you that these are the basic principles that one has to follow. Our thinking is because you have seen in last 2-3 years that guidelines keep on changing. The gold standards keep on changing. When the economic issues come, then they start saying that no, people should join as early as maybe day 5, because so many people have left the institution, they are suffering, and the crunch is there in hospitals also. The healthcare workers are also supposed to join after day 5. But no, our thinking is we should know about the guidelines, but we should be having that moral responsibility also, that if I was positive and I was symptomatic, I was the carrier also, I was the spreader also, and that means I should isolate myself. Once I have isolated myself, once I have stopped spreading the infection, that means either the virus has been killed and still it is RT-PCR is coming out, but maybe 2 or 3 days more, and then once it comes out to be negative, then I will not be the spreader. Ultimately, what is the purpose of isolation? Purpose of isolation was that we should not become the spreaders. So we isolated ourselves so that the family members are also not infected. And then once we are sure that we are RT-PCR negative, then if we are sitting together collectively or working together, then the chances of passing on one infection to another is definitely reduced. But still, as you have rightly pointed out, Anjana, please, for God's sake, do not forget those mantras. Number 1 mantra was 2 masks, not 1 mask, 2 masks. And as healthcare workers, one should always have the N95 mask and the surgical mask and nicely fitting mask, so that ultimately the virus is not going to creep in. Good hand wash. One has to make sure anytime and every time. It is not a difficult science. Our Nani and Dadi used to teach us that whenever, for example, you are going in for sitting for dinner or lunch or whatsoever, please wash your hands nicely with soap for 30 seconds. They could not specify 30 seconds at that time, but still meant it. And distance, social distance has to be there. So our thinking is, please do not forget the basics. God is going to tell you the basics again and again, century after century, virus after virus. Please, if you start forgetting those, it will come back, as Vikram was asking, Omicron and Zeta and Delta and Epsilon and so on and so forth. It will carry on working.
Absolutely, sir. On that note, when you're talking about basics, if you remember the old Indian houses, I mean, we used to wash our legs and hands outside and then only come inside the house.
Exactly.
So that was the basic ancient practices. I mean, of course, practices change because we are living in a different system. But I think, that was the whole thought process at that time also. The germs or the infections, everything is washed out and then only you come inside the house.
And
anyway,
second, as I mentioned, that in for example, 1914, and people did not know that why it is said, God bless you. As soon as somebody would sneeze, God bless you. This was the reason that please do not give the virus to somebody else, and then he or she may start suffering from today. So God bless you, man. You had the virus from the person. So our thinking is, please try to learn. Please try it. And I think it is an intelligence failure. And let's be very honest about it, that we are not able to understand this thing even, that it is human to human transmission.
Yeah.
We are unnecessarily blaming the Wuhan or Delhi or XYZ. It is human to human transmission. So we should be careful. And if we are not able to take care of our own health by these basic steps, that means we are not intelligent enough. We are
That was a good one, sir.
Intelligence failure.
Sorry, Sachin, I interrupted you. Please go ahead.
Yeah, sir, I have one question from my side, that generally it is said that if your city value is more than 20 in RT-PCR, you are not a spreader. Means even if you have isolated yourself at home, but if your city value is more than less than 20, sorry, so chances of getting spread is more. So what
Sure.
is your comment on
No,
that?
you have answered it nicely. Basic thoughts were that when the COVID testing was done, when the RT-PCR was being done, then CT values were given lot of value. And then ultimately it was, as I told you about 0 to 35 equation. Similar,
Right.
if you had a CT value of 15, definitely the viral load was big and you were able to spread it to other people also. But if the viral load had become 25 or more than 20, definitely the load was less. Or second thing was whether we are testing the dead COVID virus or not, that was also there. So now thinking is loud and clear that even if, for example, once you get the RT-PCR tested, once you are RT-PCR positive, maybe after 7 days, you again get in the RT-PCR and you still see that your score is 27, 28. Maybe you are not a spreader at that time, but maybe the killed virus is still being picked up by these microbiologists, and then once it becomes negative, because the killed virus may remain in the throat or the nasopharyngeal area for maybe 3 to 6 weeks. So some people have taken even 6 weeks to come back to negative. So thinking is that is a gray zone still it is a gray zone. So but respect that it all depends on the viral load.
So you mean to say, doctor, ki even if you are tested positive in the second round, suppose after 10 days, and your CT value comes to 27, right? So you should get yourself isolated till the report comes negative.
I would say yes. Why? Because not again and again, I am saying that scientific data is not there. Again, it is the moral responsibility that if you join the company and if you spread the infection to your colleagues, juniors and all, then who is responsible? At least I feel from within that if I have COVID positivity, if I go and on day 7, if I get myself tested, and if I am found to be positive, I should not go into my theater and infect my patients or infect my staff. So once I am negative, then definitely they will also be comfortable, but still the precaution should carry on.
Right.
Yes, Mr. Sachin, just the thing is because this virus is behaving differently in the human body. Every human body, it behaves differently. If for example, it is transmitted to the other human being, though the CT value is on the higher side, but in that human being, it can replicate much faster. So rightly said by Dr. Sir, that basically you should come negative, then only you should be coming in the crowd.
Right.
It is basically, as I mentioned, that these are not the guidelines, but still one has to follow the norms. That if you believe it, it's okay. If you don't believe it, then if you go, for example, I would put it other way around, Sachin. If I was positive and on day 7, I get myself tested, I am still positive, and I go to my theater, I start operating. On day 3 or day 4, my staff also reports, sir, I am having fever, sir, I am having sore throat. So do you think that I will have the responsibility or not? I
Yes.
have. So my thinking is that these are multifactorial factors which are responsible, but in totality, one should always see that we should not be the super spreaders, we should not be the spreaders. We should try to contain the virus as much as possible. We should behave intelligently so that all of us are wearing mask, cap, distance, and so on and so forth.
Absolutely. A very interesting question I will take at this juncture. Mrs. Satpal Grewal wants to know, can one get Omicron more than once?
Yes.
Yes, that is the basic thoughts are these. Again, with this context only, I would put a caution on this. Many people, many doctors, many people had taken this for granted that I had dose 1, I had dose 2. So how does it matter? Now I should attend the parties and I should mingle with people without the mask. Why? Because I have already been, my immunity has already been boosted up. But no, they have also been proven wrong, that even if you had 1 dose of vaccine, 2nd dose of vaccine, but still you can get infected. Similarly, there are situations, there are people who have been infected with coronavirus once in the first wave, Like our chief minister also, all of us know that. I don't want to know.
Yes.
First wave also he got infected, second wave also he got infected, and then now third wave also he got infected. So even if you are having the vaccination, even if you are having infection, once it is possible to get reinfected if you are not sticking on to your basics. Please take care of your basics.
Yes.
Mr. Vijay Singh's question is very interesting and something related to this, and you have already answered. He's saying, what is the logic behind world #1 tennis star Djokovic not taking COVID vaccine? Is he not setting wrong precedent for the millions who follow him?
Good question, but answer is very simple. I have also been following him, and whole of the world is following him. But only thing is that at the moment, there is no fixed rules. There are no fixed guidelines. He says, I had been infected. I had COVID once. I had COVID twice. That means I have the antibodies. Yeah. And if I have the antibodies, then, and you also know it, that if, for example, somebody had the Omicron at this stage, then also it is advisable not to go in for boosting for at least 3 to 4 months. So even if I have the Omicron and if I am not allowed to go in for booster dose for 3 months because the antibodies are already there. So same way, he has the plea, according to us, he has the plea that because he had once developed the antibodies, he had developed the antibodies again. And that is the reason that he had declared it openly that he had antibodies, and now he should be allowed to play. But as you know, that in this intelligence failure, there are people who are absolutely anti, and there are people, even, for example, if some normal human being would have been there, they would have said, yes, you have the antibodies, you have tested the antibodies again and again, and you are still not infected, you are not a spreader, go ahead, play. You can play now. But I think there are gray zones, and it is so vividly seen all over the world that any and everyone is full until proved otherwise.
On that note, I would like to tell everybody who's joined this seminar, I mean, we will not allow people without vaccination. So we want all of them, first dose, second dose, booster we are facilitating. We will want all of you to take your vaccinations, and we are not bothered about any tennis star, film star. It's Apeejay group, everybody has to be vaccinated, right?
No,
Sachin?
it is. I would put it, Anjana, I would put it this way, that please
Definitely.
ask your moral values. You should have the values that I want, that I should not spread the infection. I want that if somebody tells us that the vaccine has provided the immunity, 1, 2, and then it is causing the less of infection. I would put it this way of presenting that how many of you know, Vikram and Sachin, that we should wear the seat belt when we are driving. What is the reason behind this?
It is for our safety, sir. It is not only for our safety, but the safety of our family members who are sitting with us in that particular car.
How it is safe to wear the seat belt?
Because, sir, when we are wearing the seat belt, the means even if our car is hit by someone or during the accident time, the point of injuries would be less as compared to.
Anjana, do you think that this is the right answer?
No, it is not. What I feel is that if you are in a running machine, it is bound, and we cannot predict when we will have an accident or not. So it is always better to wear the seat belt, because the impact when you hit another car or you meet in an accident will be much lesser. But the impact will be there. It is not nil.
Dr. Manju, do you want to answer that?
Yeah, actually, I would also add that when the car is being hit, if we are ejected out of the vehicle, that is even more dangerous. So if you are using the belt, you will not be ejected, you will be there. At least you will not be hit by the road or the passing by vehicles. And also not...
Even one more thing, sir, that this will basically protect whenever there is an accident, that head, especially the head part,
not ejected.
will not bang on the front part of the car.
No, but now you listen to the answer. The answer is, if the seat belt is on, then only airbags will open.
Sir, those are with very high-end cars. Supposing there are people who are not in those high-end cars.
Absolutely.
No, that I'm saying. So
That's-
our thinking is that in Walter Bushnell also, in Apeejay group also, please tell them
Yes.
that if you are wearing a seat belt, then only the airbags will open, and then only you will be safe.
That's right.
So if you are having the vaccine, if you are having another vaccine, if you are having the booster, then only you are safe. So please do not think that because the challan will be there, that is the reason that I have to wear the seat belt. No, the answer is it has to come from within. When I have now, you have seen the people, now the cars, the high-end cars would be if there are 6 airbags opening. Previously there were 4. So our thinking is that it has to go into the minds of the people that we are working. There is safety in more safety. Please take all the precautions for your own safety, for the safety of the staff also.
So, sir, similarly, when we get a challan for not wearing the seat belt, people are not wearing masks and literally fighting with the police. I again request, because this is something which, like you said, we are behaving not only like non-intelligent people, we are also behaving like uneducated, and I will not even use that word because people are conscious. But please don't fight with the police. Please don't fight with metro police who comes to you and says that please maintain social distance. We all understand that this is a time when there is a lot of pressure and strain on every one of us, but we need to be very, very aware, and it is our moral duty, like doctor said, that we need to keep ourselves safe and also others safe.
I call this as moral policing.
Moral policing as well. Yes, absolutely, sir. Sir, interesting question from Sumit. He is asking, Sumit from Pitampura, Apeejay Pitampura, wants to know that if someone is suffering from COVID, can he do exercises like running and cycling?
Once he had suffered, or he is still suffering?
If someone suffers from COVID, that is,
if for example, at the moment, I would put it this way, that if somebody is having Omicron, then the main features which we discussed in the beginning also were the fever, the sore throat, the malaise, the weakness, the mental confusion. So if you start exercising, you will not be able to even exercise. You will not be able to even exercise. But once you have become negative, gradually your muscle, because all of us have seen in last 3 waves that it used to take around 2 to 3 months for the complete recovery from the COVID infection. So it is good idea not to overexert, but to do it in a moderation and gradually increase it rather than suddenly jumping for weightlifting and whatnot.
A very interesting question from Dr. Manpreet Singh Sehgal. Do virus mutations occur automatically? Can we guess the next mutation in advance so that we can get prepared in advance? Exactly. So that's a very cute one.
I would say that you have to become God. If you are able to guess it, even for guessing, you have to become God, because these are the viruses which they want to stay on. As I mentioned, the virus or any creation of God, it wants to stay on. So it do not want to be extinct. So the virus also wants to have the nutrition and wants to replicate as much as possible. But I would put again in this manner, we are so sub-intelligent that we have not been able to even understand that what mutation is going to come and what precautions have to be taken. You never know. And believe me, there are people answering to in the same tone. There are people who are thinking, as had happened in 1914 to 1918 influenza period, that first wave, second wave, and third wave, maybe this Omicron is a blessing in disguise and the virus will go off. So all the mutations will go off and it will become the part of our life. That initial small flu is there, small fever is there, small infection is there, and that's it, and you have to live with it. So you are not at all certain what is going to happen.
That was Dr. Gurvinder Singh's question, that do you believe corona is near endemic stage or as some other experts are suggesting?
I wish that pandemic should become endemic should go ultimately die off.
But sir, on a lighter vein, there is a possibility like now your watch can, measure your ECG and whatnot, they can track. So probably in future, we will have a watch which will track an Omicron molecule around us. It will beep, it will start beeping, beep, 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 corona around you.
But again and again, what is the lesson of the whole COVID era? My lesson is, even if human being tries to become smart, the smallest virus, so small a virus, has become smarter. Even if so much of healthcare facility has been there in US, UK, India and whatnot, but still it has been challenged.
Yeah.
So thinking is, it is a continuous process. You should carry on improving your own self, carry on learning for your own self, and then make your way rather than scumbing on the way.
Yeah. Neeta Mathur is asking a very relevant question here. How authentic are the self-test kits? Can we depend on them completely?
Wonderful. I think again the time is going to tell. Yeah. Let's be very honest about it, that this is a very short time frame which the self-testing kits have come. But again, if they prove that yes, it is beyond doubt that positivity is there, definitely it will help.
Sir, one question from my side. I was reading a newspaper that in UK, they have made means that flight coming from any part of the world, they are not going to test them on COVID because now they have to live with COVID.
That is what I'm saying. That is what I'm saying.
Do you, my question is, don't you think that in our country also, the test means we are doing so many testings. So means, but Omicron means being a smaller variant as compared to Delta. So it should spread so that the this antibody should be developed and we should walk towards the herd immunity.
That's what I am saying, that at the moment, it is a little knowledge.
Yeah.
Any and everyone is suffering from little knowledge. It is not, the virus is such smart that it is not allowing any and everyone to have the complete know-how of the way it is going to spread. Now you will see, today I know that you are referring to one news item which was there today only. Maybe 5 days after, again England will go back and they will say, no, we will have the testing again. So what I mean to say, it is totally a liquid state. Nobody understands the mechanisms. No, and the only tragedy of the story is that the economic reasons, the government reasons, the associations, the guideline giving people, so there are so much confusion is there, and they are starting putting the blame on A, B, C, D, and ultimately we are still progressing, but we may not know where are we going.
So
absolutely,
yeah, Dr.
Yeah, I have one question, sir. When to start Molinovira?
Yes, good question. Answer is not to start.
Yes. What I wanted to hear from you, because there are many people who have started to take it by themselves.
No.
So it should not be taken on their own. It should only be taken after consultation with the physician, if required.
If required, and if you are having comorbidities. For example, if you are diabetic, if you are hypertensive, if you are more than 60 years old, and if it is the initial phase of Omicron, 1 or 2 or 3 days, yes. But again and again, I would put it this way, that please, yes, one should have the Pandora of knowledge, one should know about it, but one should not practice on our own self. Many times all of us have seen the last era also, last wave also, so many people hoarded the remdesivir and so many medicines and they were taking it just like as if they are taking water, and they were harming themselves. So our thinking is that please do not leave that thought to your own self. Consult a physician. If you are having comorbidities, again and again, I am emphasizing on this aspect, that please make sure that if you are having diabetes, if you are obese, if you are hypertensive, if you are having heart disease, if you are having kidney disease, please try to consult your doctor virtually or physically many times, so that even if you are having any change in behavior, please, they should also be on the same page and give you the best possible treatment.
Interesting question from Dr. Sucharita and Aarti ma'am. So like initially it was said coronavirus stayed on different surfaces for different duration of time. Is that true for Omicron? And does it remain on the clothes? That's the two questions.
Again, answer is very nice that no, it has not been proven.
Not been proven.
Not been proven. Rather, it was, now people have started thinking that it was a hype unnecessary which was created. It was never ever the surface to surface. It was because of the aerosols which was the infection was spreading.
One second, sir. There are a lot of questions. In the interest of time, I am taking all the important one. Sir, when can one get a booster dose of vaccination post recovering from Omicron? This is from Ishita Adhikari.
Sure. This also we mentioned that if you had the Omicron recently, then it is a good idea to wait for at least 3 months and then go in for booster. If you did not have the Omicron, but if you had the first dose of vaccine, second dose of vaccine, and now 9 months have elapsed, then definitely one should go in for boosting. So our thinking.
How can you? Yeah, sir. Sorry to interrupt, sir.
Our thinking is, yes, please make sure that you are having. If recently you had the Omicron, wait for at least 3 months. 3 months, and then get yourself boosted.
Absolutely, sir. Sir, what is the treatment of Omicron, and when should you, if you're not, before getting actually tested, what should you start yourself on? And if you start yourself on something?
Quarantine. Only answer is quarantine. Even if you have a slightest doubt that your throat is scratchy, if you are having fever, if you are having chills, if you are having malaise, quarantine yourself. And then if the temperature is going beyond 100 degrees, then take Crocin or Calpol or Dolo, that's it, and carry on isolating yourself. And then within 3-4 days, the viral load will definitely come down, the fever will come down, the throat will also settle down. And in the meantime, you should have got yourself tested. And then once you have taken rest for 5 to 7 days, then only start thinking of retest vis-a-vis rejoining.
One question from my side. Sir, till the last year, there were some news of nasal sprays also. So what is the status, sir, regarding this nasal spray? Will they come into the market?
Sure. I think the lot of work is going on. And I am not honestly sure that when are they going to come, but they will come. They would come.
Right.
So one question which is very interesting. What is being asked is Ayurvedic medicines, and especially, we've been told to eat giloy and I don't know what all things. Is it necessary? I mean, will it have the same effect as the Ayurvedic, antibiotics?
I do not pretend to have any knowledge about any Ayurvedic product. My knowledge is absolutely limited. So that is the reason that I will not be able to give any comment. Last time also I never ridiculed the kahwa, kada and whatnot. But this time also I would say that honestly, I do not know whether they have any kind of role or not. Only thing is masterly inactivity. You should not be much bothered if you are having a mild infection. It will settle down. Don't overplay. Don't overplay. But if you are having some comorbidities, then definitely consult your allopathic physician and then take the proper medication at the right time so that you are also having not severe, not moderate, but mild, and then you come out.
Understood, sir. Sir, CP Goel sir asking, just now you said if Omicron affected you are affected with Omicron, then can get again affected. But you also said that you will develop antibodies for the next 3 months. So then why Omicron will affect twice? I mean, you can be affected with Omicron
Very
twice.
good.
That is his question.
Mr. Goel always asks excellent questions. Yes, definitely. I never mentioned that this much will be the level of the antibodies which will be formed. For example, if you had the vaccination 1, vaccination 2, and now you are having Omicron, maybe the antibody level was X. But if you have become bold enough, and especially at your age or my age, that we do not put in the mask, we go and intermingle with people, we do not wash our hands, we do not maintain a social distance, Omicron is still going to invade our throat. Maybe it is not going into our lungs, but still it can, and the viral load will increase, and there will be a fight between the viral load and the antibodies. So if the viral load is more, obviously the antibodies will not be able to do anything. And if the antibodies are more, then viral will be dead, and that's it. So why should we let Omicron virus play in our body? Please try to dissuade it.
Before going on this is Renu who's asking this question. You have already answered, but it's an interesting one. Before going on for booster dose, do we need to get our antibodies checked? Because it is said that the number of antibodies should not be more than 40. You have already answered this, but still, sir, yeah.
Still, I would say that it is not imperative, it is not mandatory to go in for antibodies tested again and again and again. No, our only thing is that if you follow the basic norm, that previous the second dose was 9 months behind, and then you are going in for booster, go ahead. Do not try to check, recheck, cross-check, counter-check, and then go in for vaccination. There is a role of boosting. There is a role of vaccination. So please respect that, and that's it.
So another question is, if 2 COVID positive in a family, very mild symptoms, is it necessary to have COVID test for others in a family in force?
Yes, definitely yes. As I mentioned that if, for example, if you are having positivity and if you are a spreader, then you should let the other family members, especially the elderly family members, separated off so that they do not suffer. Because ultimately, as Vikram was also mentioning, it all depends on how much you are able to, or your body is able to fight that. So if you are, for example, having maybe 70 years old parents, and they are also having comorbidities, and if you have tested yourself and you are still moving around in the family, if they get it, maybe the cascade of events will be far, far worse. So it is better to get them tested so that, and plus isolation should be there, quarantine should be there, and it should be religious. But honestly, I feel that why there are questions of not following it properly. We should follow it religiously so that ultimately, even if the trouble has come, we should be able to overcome that.
On a related note, Murari ji is asking, RAT is negative, but RT-PCR is still pending. So, but he has symptoms. So what is the next steps? I mean, should he go for some treatment?
Yes, no, not the treatment. Wait for the report, it will be positive.
Yes.
Because answer is loud and clear that one has to maintain that patience. So if you are patient enough, if the report comes to be positive, then don't jump in for treatment, jump in for quarantine, home isolation, and then if the fever is there, take Calpol, Crocin, that's it, and isolate yourself, and that's it.
Sir, in the Delta variant time, that is the last phase, there was a list of medicines. I mean, a concoction of medicine was used to give, and people actually stored it at their place. So is the medication different for Omicron? And it is. Manju ma'am did ask, but what the question is the medication same for both the viruses?
No, you very nicely asked. As you know, that last time, first wave and second wave, lot of stress was given to the antiviral drugs also. And they were marketed, they were black marketed, they were manufactured, and But overall, after getting hit and trials, all of us realized that not much role was there. And especially in Omicron, it has been seen, it has been proven also that there is no role of starting the antiviral drugs. There is no role of any Molinovira drugs also. So our thinking is, let it contain itself. If you are, only thing which you could have done for your own benefit was vaccination. So if you had vaccine 1, vaccine 2, and still you are having Omicron, it will settle down. It is going to settle down in a milder form. It will ultimately, you will become asymptomatic, and that's it. No need of searching for oxygen and antiviral drugs and steroids and so many things were seen last time. Please do not make it high sounding, make it simplified and treat yourself, rest yourself, that's it, full stop.
Sir, I have a question on booster dose. So the booster dose we have to take after 9 months, at least now it is open for all the 60 plus citizens. So by the time it will be open for all, it will be at least another 1 more month or 1.5 months. That is a gap period of 10 to 11 months after the second dose. While in many of the other countries, it's after 6 months. So what is the, is it the right duration? Or, I mean, people are, they have this question in their mind. I mean, will the antibodies last for 10 to 11 months? Or is it that it's just that there is a period which the government has fixed for you. So of course you cannot do anything about it, but is it that towards the end, that is probably after 8-9 months, what we were discussing earlier, that the infection will be milder, it will hit you strongly after that if you're not getting the booster because your turn may not come in? That's the question.
But I would put it this way, that I wish that our scientists especially were smarter enough to give the rigid, clear-cut guidelines to us rather than the governments giving the guidelines to us, rather than the associations giving the guidelines. What I mean to say is that if, for example, one vaccine has been given, then the government starts seeing whether, if, for example, if they would have allowed it for one and for all, for boosting doses, they are always seeing whether we will be able to manufacture those kind of load or not. So many vaccines will be available or not. So our thinking is that it should not have been mixed, the demand and supply and the science. They should not have been mixed. There should have been some scientific answer, as you have rightly asked, that yes, the antibodies developed, reached up to the plateau, has started coming down after 9 months, so go in for booster, full stop. That kind of answers would have been enough. And especially when you are asking healthcare workers also, as healthcare workers also, we are giving booster to one and all, and more than 60 years, yes, one and all. So our thinking is not one specific answers have come out from the scientific people, from the science, who had studied these antibodies, who should have studied these antibodies in a large volume and then given us the direction, rather than the government changing the instructions every now and then.
That is the reason.
It is a universal. I'm so sorry that many times we start blaming our center versus state. Our thinking is, no, it has been a universal phenomenon. Even in US, even in Europe, even in UK, any and everywhere, once these politicians start behaving like doctors, then the situation becomes so messy that you are not able to come out.
That might be the only reason that even after the second vaccination also, the people are getting the infection. Might be reason the antibodies level are coming down. That
yes,
might be
that's what
that's what I'm saying. So still the foolproof answers are not there.
Right.
Foolproof answers are not there. Still the vaccine has not been developed to that level that it will say dogmatically now onwards you are not going to have any infection. Still you may have, but you may have the milder variety.
I'll take this last question. Ogra sir wants to know, does the virulent nature of Omicron decrease with each day after it has infected a person?
Honestly, I do not know. we have seen that if the Omicron is occurring, and we have had good number of patients now, so they are telling us that on day 3, day 4, the fever goes off, the throat also starts behaving normally, the speech also is okay, and on day 5 to day 7, definitely the load decreases, and maybe day 10, once they go in for a repeat test, it is not there or it has become negative. So obviously the viral load comes down. But the beauty, again, I would say that there is advantage of the adversity. And as Vikram was asking me, that you should always tell the stories also, the positive side also, that you should take the advantage of this adversity. That means our virus has been tamed down to some extent, that it is not going into the lungs. It is making its residence only in the throat, upper respiratory, and then ultimately giving you some buzz of fever and sore throat and whatnot, and going off. So why not be happy about it? Why not celebrate? Thank you, Omicron, that you are going in only for our upper respiratory tract. You are not going in for our lungs. As I told last time also, Anjana, I would reiterate the story that Thomas Alva Edison, he all of us know that he invented bulb, and I can see the bulb behind Vikram and behind the 100 million bulb or so on and so forth. So when he invented bulb, and then one day his factory got fired, and when the fire was there, he called his son, Charles, come here, come here. So Charles also could find that all the factories, because it was a factory of bulbs and it was a factory of chemicals, so many chemical reactions were occurring. So whole of the factory campus was on fire. So he said that go and call your mother. Charles was surprised that how can it be that Thomas Alva Edison tells me that call your mom, and when she was called, he says that I don't know the name. He says that please see, you will never be able to see such a fire in the campus. This is the unique opportunity to see the fire. And can you imagine, the whole of the campus of 10 factories was gutted down, and next day morning he called all the people. No one had died in that accident. He called all his employees and asked, what next? Just find out that when are we going to restart? When are we going to restart our factory? And he asked Vikram, please find out where shall we get the money from? And ultimately, that is the positive way of looking at things. So this too shall pass. Please believe on this aspect that this is going not to last for long. This too shall pass. Omicron is going to go, and we will again have the similar or better life. So only thing is, please try to learn out of these periods.
Thank you so much, sir. We will keep on asking questions, but there is a time constraint as well. Thank you so much. It was a pleasure hearing you. Over to you, Vikram, sir.
Once again, on behalf of the entire Apeejay family, sir, thank you very much. Sir, you motivated us during the first wave, even during the second wave also, sir. We sailed through that also. And during the third wave also, sir, you have motivated us. But sir, ये है कि चौथी वेव ना ही आए, पर आपके लेक्चर चलते रहने चाहिए.
Yes, definitely. I also wish that chauthi wave nahi aaye, but only thing is that we should be thankful to God. We should be grateful early in the morning at 4 a.m. or 5 a.m. that today also I am safe and I should remain safe. And I am thankful to you for all you have given to us. Please try to be grateful. That he wants us to realize this only, that he has given us so much. Still we are not grateful. And if whatsoever is missing, that we are trying to find out, please do not run after goat number 3. Run after goat 1, goat 2, and goat 4, but goat 3 is missing. So do not run after goat 3, and please be thankful and grateful to God that we are having great health. Let the great health continue. These pluses and minuses will come. They should teach us lessons, and we are ready to learn all those lessons.
वो पुराना गाना था कि तुम बैठो मेरे सामने और हम सुनते रहें, तो सर आपके साथ वही होता है अप्लाई. कि आप बोलते रहो, हम सुनते रहें, and this really motivates us.
No,
Thank
but
you.
I honestly, again and again, I would, through you and through everyone, I would say that please be grateful. Please be thankful.
Right, sir.
Thank you so much, sir. Thank you,
Thank you,
sir.
sir.
Thanks.
Thank you,
Thank you, sir.
Thank
Thank
you,
you,
sir.
sir. Thank you.
Thank you. Thank you, Sachin. Thank you,
Thank
Dr.
you, sir.
Manju. Thank you, Anjana.
And thank
Good
you,
job,
audience,
sir.
for patiently being with us. Thank you so much.
I would say, Anjana, you did the best job. Why? Because it is not possible to read and then frame the questions and ask them so specifically. Good job.
And
Excellent.
and even to reject the questions also, sir.
I know.
Question में reject भी कर दी है.
So nice.
Thank you,
Thanks,
sir.
God
thank
bless
you.
you.
Okay, sir. Thank you.
God bless you all. Thank you.